Hey, it's Jeffrey Lin. I want to do a quick tip on identifying your chronic illness and knowing what medications you should take. One of the biggest problems I see with patients and doctors is they think a disease with the same medical name are all the same. For example, people think eczema is all the same. And so they often suggest to me what I should do, or they think somebody else have what I have, but there are thousands of variations just within the eczema category, and that's usually what people get confused about. Even doctors, I think doctors kind of purvey that, kind of make that worse, because that's usually when a patient first hears about their disease or diagnosis, and a lot of times a diagnosis isn't really a diagnosis, it's just like a more specific identification of the symptom. But to correctly deal with your illness and find the medications that work, or even holistic diets that work, you have to correctly identify what the root cause is, not just what it's showing up as, which is the disease or eczema or allergies. A lot of times those are just a manifestation. What the actual problem is showing up as, that's not the actual problem that you're trying to solve.
Hit it! That's what I'm talking about. Wait!
Okay, now, from the beginning.
Hit it, boy.
Good morning from Rotterdam. Heading out to Amsterdam in a bit, but since the rain cleared up, I think I'm going to go out for a quick bike ride. Looks like these are the bike sharing bikes that I'm trying to scan and rent. The wind is just super strong here in Rotterdam. If you've never been here, you probably don't know what it feels like. So the wind just probably knocked these down. Hey, it's Jeffrey Lin. Welcome back to my channel where I'm talking about living with multiple chronic illnesses. For me, it's severe eczema, asthma, and allergies. It's a triple immune combination that I don't think anybody else on earth really has as severe as me. Research doctors have told me that my eczema is probably like the top 3 most severe, and also allergies is right up there. Super off the charts with all the allergy tests that they can't even really test for how severe I am. So that's kind of where I'm coming from. And on this channel, I do a lot of like chronic illness hacks that I've just had to develop for myself over the years, just because doctors and medical science really haven't really caught up, or there aren't very many doctors that know how to deal with situations like this. And I'm just trying to share my experiences and kind of help you with that, and see if you can use some of the experiences that I had, instead of having to like live through that and figure that out all for yourself. The problem most patients and doctors have is incorrectly identifying what the root problem is. They usually just stop at what the symptoms are. So if you have very dry, cracked, scaly skin or really rubbery skin, they just call it eczema. Obviously, there's scientific things to look for, but really most diagnoses are just symptoms of what's showing up, and it's not the root cause. For example, just putting on a lot of steroid medication to calm down your skin doesn't actually solve the eczema problem. It's just masking it temporarily, and then the steroids will cause damage to skin, so eventually your skin actually gets worse, your eczema gets worse. That's where the topical steroid withdrawal comes from. It's improper use of steroids trying to calm down the inflammation in the skin, where that's a wrong approach. Steroids in general are pretty good at calming down inflammation temporarily. So for a normal person who doesn't have severe eczema or any other severe chronic illness, steroids are a good choice for getting them over a critical stage, so it doesn't turn into a full-blown emergency or a crisis. But for people with severe eczema where your skin's already damaged, using steroids, whether if it's prednisone that you're taking through the mouth or using on the skin, steroids creams on the skin, it's just going to damage your skin even more and make it impossible, almost impossible for the skin to recover from. And with this last little bit uphill and the strong winds blowing, it's just I'm kind of out of breath. So another example of this is the severity or intensity of your disease. Somebody with very mild eczema or very mild allergies or very mild asthma shouldn't be treated the same as somebody with like a medium level, and definitely not the same as somebody with very severe allergies or eczema or asthma, just because the things that that person reacts to is different, and a lot of the medications that work on the basic level won't work when you're at a very critical, very severe level. So for severity, oftentimes you got to think of it as a different disease. You got to use medications that you wouldn't usually use for asthma or eczema. So like for me, because my allergies and eczema are so severe, none of the typical allergy medications or eczema medications even did a thing, even had a dent. It's like throwing a speck of sand at a train. It's not even going to notice that that you took that medication, just because it is so weak compared to, in this example, it will be the train is the chronic illness, and the speck of sand is the medication. So the speck of sand is just like a very basic medication that works for most people, but against a moving train, it's not going to do anything. So for me, like, I have to take the immunosuppressants, which is a very strong hammer that knocks down my whole immune system to calm down my allergies and eczema and asthma. And usually these kind of medications are super toxic. Very few doctors are willing to prescribe it. Some are even used for chemotherapy or for transplant patients at a very severe level. And even for them, they only use it for a couple months, whereas I've used it for many years. And they say, you know, using immunosuppressants for like more than three months or a year is pretty deadly. You'd probably be dead by then, but I've survived for 11 years. So there's just a lot of nuance and little details when you really get into trying to identify your illness and what kind of treatments that is the right application. And usually doctors as well as patients don't have the patience and the critical thinking to think about things in such detailed manner, like a case by case, and even moment by moment, because the disease does progress and change over time. Sometimes it gets better, sometimes it gets worse, and you got to shift. So if your disease is really severe, but eventually starts getting better, you got to get off of those very severe medications and switch to the basic ones that didn't work before. And a lot of people are afraid to make that jump because they're afraid that their disease will flare up and get worse again, which is possible, but you can't use a very strong medication for a improving disease, you know? One more thing to think about is complexity. If your disease has a lot of the symptoms that is usually associated with it, or when you look it up on like WebMD or other medical sites, if you have a lot of those symptoms, or for example, if your immune reactions, allergies, asthma, react to a lot more things than most people, then your condition is probably a lot more complex and probably different than somebody who only reacts to one or two things. So for example, if your food allergies is just like the basic, peanuts or even wheat or gluten, that's one kind that's quite basic. It's like a step up from having a runny nose or sneezing a lot, but it's still quite basic. I mean, it's basic compared to like when I have a reaction, it's if there's seafood cooking about a mile away and I'm inside a car with windows rolled up, I'll still have a reaction. That's like a difference of severity as well as the number of things that I react to. Everything I've been tested for I'm allergic to. Like literally there's nothing on the planet that's not just allergic, but also toxically allergic. So you just gotta compare the complexity and the scale of your reactions and deal with your condition accordingly. One last thing to consider about helping to correctly identify and diagnose your chronic illness and knowing what medications to take is seeing if your condition is connected with any other illness. If you have multiple illnesses like me, it's not the same as if each of those are separate conditions. For example, my multiple immune illnesses are allergies, asthma, and eczema. But for like the first 26 years of my life, all the doctors only try to treat my eczema because that's what they saw, because it was the most physically obvious, and they didn't connect it together that it was at its core an immune overreaction to everything, and that shows up as eczema on the skin and as asthma from breathing and as allergies both internally with the gut and inflammation, and also just like breaking out in typical allergy stuff. So when you have multiple illnesses and they interact together, you can't treat it as if they were separate. The body is one big system that overlaps, and all of each disease kind of feeds into each other. So even if it's not the same disease at its foundation like mine is, the body's chemicals and signals and even just the nervous system that connects all the parts of the body are interrelated. So when you have one disease that gets out of control, it's going to wear down your body, and your body has a harder time fighting any other illnesses that you have, and that might be why one condition leads to several other conditions. But you can't just treat it as they were individual problems, because that doesn't work. Sometimes it'll help to, if you're able to get one under control, then the other ones would improve. Sort of like when my eczema improved a lot from taking Dupixent, then my allergies and other inflammations came down a bit, because the eczema and allergies all occur because the body is having inflammations in different areas. So for the skin, eczema is inflammation of the skin, and for allergies, and inflammation of your gut or your sinus or even your nervous system. But that's what you're dealing with, is multiple systems, multiple things interacting together. You can think of it like if you only work for yourself, it's a lot simpler than if you're working in a company with 5,000 people, where there's multiple parts and multiple levels of organization, multiple departments you got to deal with. You got to deal with your coworker that's right next to you, but you also got to deal with your bosses. You got to deal with the bosses in other departments. You got to maybe deal with coworkers in other countries. It gets very complex, and the body is that complex. All right, guys, thanks for watching. My name is Jeffrey Lin. If you found this video helpful, please hit the subscribe button, and also share it with anyone you know that's suffering and having a hard time figuring out how to deal with their illness. And if you're suffering through some of these same things, or if you have any questions, leave a comment below, and I'll answer every single one of them.